Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action.
Hello and welcome to the SRHM podcast, where we delve into the latest research on sexual and reproductive health and rights from the SRHM journal. I'm Emma Pitchforth, Executive Editor of the journal. Today we're discussing an important article recently published in the journal, one that explores the barriers and facilitators influencing participation in syphilis vaccine trials, offering critical insights to inform ethical trial design and community engagement in the United States. I'm honoured to be joined by three of the paper's authors, Suzanne, Justin Radolf and Joseph Tucker. As an editor, it's obviously a privilege to read the research that comes to the journal, but it's really great to have the opportunity to meet authors in person, to be able to talk through the research a bit more. It struck me when reading this study that it was both important, but also a study that must have needed great care in the design and conduct, given the history of ethical and rights violations in syphilis research. So I'm really excited to have this discussion today. Suzanne Day is a research assistant professor at the Department of Medicine, Division of Infectious Diseases at the University of North Carolina at Chapel Hill. Justin Radolf is Professor of Medicine and Pediatrics, Director of Research in the Department of Medicine. He's also a Senior Scientific Advisor at the Connecticut Children's and CT Children's Research Institute. And Joseph Tucker is a Professor in Clinical Research Department of Faculty of Infectious and Tropical Diseases at the London School of Hygiene and Tropical Medicine in London, UK. And he's also Professor in the Department of Medicine at the University of North Carolina at Chapel Hill. Welcome to all of you, and thank you very much for being here. I just wanted to start off by asking you all if you could just introduce yourselves a bit more, perhaps less in terms of titles, but a bit about your background and how you've come to this research.
Yeah, sure. Thanks so much, Emma. I can go ahead and start. So I'm actually a sociologist by training. It's my passion in life. It's my thing that gets me up in the morning. And how I've directed my interest in sociology is looking mostly at social and behavioral issues related to STIs and STI research. Mainly, my interest has been in participatory research methods related to STIs and STI prevention. So that's kind of what I'm interested in.
Thanks, Suzanne. I'm Joe. And I'm an infectious disease physician and also a lover of syphilis, a syphilologist. I really have been fascinated by syphilis over the years, and I'll turn the next introduction over to Professor Radolf. Over to you, Justin.
I am an adult infectious disease doctor, like Dr. Tucker. As you can see by looking at me, I am one of the grand old men of syphilis research. I've been working in this field since the early 1980s. My research is basic. I focused on understanding how treponema pallidum is actually put together, particularly its outer membrane. And that's what a vaccine has to do, is target proteins on the surface so antibodies can get at them. And it was that work that led to our NIH-funded research, but we cast a very broad net. And part of that net was to bring in Suzanne into the project.
Brilliant, thank you. So it sounds like a really interdisciplinary team. I don't know if you want to say anything about the wider research team and the other authors who aren't able to join today.
Yeah, so we have other great authors on this paper. We have at the time there were two amazing graduate students. They've since moved on to very exciting careers, but we had Asia Carter and Anna Lloyd, were fantastic helpers on this paper and key contributors on this paper, really got into looking at the background of syphilis, and they were really excited about the project as well. And we also had Arlene Senya on this paper as well, who's with us at UNC Chapel Hill, an incredible clinical researcher too. Also very, very engaged in the world of syphilis research.
Super, thank you. So Suzanne, I wondered if you could start by setting the scene for the project and explaining the motivation behind the study.
So Dr. Radolf really characterized it really beautifully, like casting a net that drew me in. So at the time, we have to go back to, it was pre-COVID, it was just before actually COVID. And I was doing a lot of research around community engagement for HIV cure. So very early research into HIV cure and doing some community engagement work around what do people think about the idea of cure and how do communities feel about this and what would be the meaning of HIV cure for communities. So I'd been doing that work, really getting into engagement work. And this was mostly with Dr. Tucker. And I found out through Dr. Tucker that there was this really exciting group that had been put together that had a very big grant, and they were going to be finding a vaccine candidate for syphilis. And this was their whole goal, and was to understand syphilis better and to understand the mechanisms of it and understand how a vaccine could be developed for it. And would I be interested in talking with this group? Because they knew the importance of community engagement for this research. They knew having early community engagement is a big thing. It's a big deal to engage communities early on this. And they knew that they needed somebody with that interest and that expertise to join in. So I was like, yeah, I'll talk to them about this because it's very important. It was a great opportunity to get in early, right? You can't engage communities too far down the line because then it's not genuine. You're missing out on really important information that you need to be able to shape your research and to get people interested in it and to get people passionate about it and to have their input on it. So you have to start early. So for me, that was really like the big draw. Like things were just in the beginning. We hadn't for vaccine research. It was just at the start. So it was like the perfect moment, the perfect opportunity. And, we were also kind of in this interesting position too, where it was like, it's a different topic. Syphilis is really different from HIV. And I was intrigued by its differences, right? Syphilis is a bacteria. It is treatable and curable. It has its own really unique and interesting history. And so I was like, what might be different about syphilis that we need to talk to people about and see what their thoughts and feelings are on this? So that was, for me, the big draw and sort of the start of like, okay, I'll talk to this group that's looking at syphilis vaccine research and see what we can do for a cool project that would be around early phase vaccine trial participation.
Yeah. So first of all, what Suzanne said is absolutely accurate. What happened really as well was that as the project progressed and we would present our work on how we were going about developing the vaccine, the more basic research, it was common that questions came up about how a trial would be done, where trials would be done, how would we enroll patients who would want to be in trials. And it really opened my eyes to the need to think more broadly than just in terms of the very basic laboratory work that we were doing. And fortunately, the way the grant, we were funded as what was called a cooperative research center by the NIH. And fortunately, the way the grant was structured, it enabled us to put aside funds for new projects. And so as we began to realize how important it was to deal with the kinds of issues that this paper addresses, then lo and behold, there was Suzanne. And, it was like, wow, this is great. We have the perfect person to do exactly the project we need to get done. And that's how it happened.
Brilliant. Thank you very much for that. And I guess the paper's really about as well trying to engage, so it's community engagement, but it's particularly community engagement with marginalized groups, isn't it? And I just wondered, Suzanne, if you could say how you approached that and what the challenges are around that and what you've learned from that.
Yeah, that's a really important factor in this paper, right? We knew we wanted to talk specifically to populations that would be priority populations for syphilis vaccine trial participation, right? Like obviously the groups that you are most likely going to be rolling out a vaccine trial among, right, are the folks you want to hear the most from or the prioritize hearing from when we want to know about, would you be willing to participate in such a trial? What would participation in such a trial mean to you? And even just like the idea of having a vaccine for these priority populations, what's that going to mean for you in your life, in your community, right? So for us, it was really, really important that we focused our attention on hearing those voices and involving these priority populations for us. So we had very specific criteria about who we wanted to sort of speak to first and who we wanted to involve in this study. And so that was really key for us. And so that we could feel like we were learning from the people who would matter most to us in rolling out vaccine trials, right? So I think that was really quite key. And when I was talking with people and asking them questions like, from your perspective, who do you think needs a syphilis vaccine the most, right? And then I would ask too, like, who do you think is most important to hear from when we're developing a syphilis vaccine? Whose input do you think we need to be getting the most? And people would tell me, well, it's who's participating in this study, Suzanne. Like, it's MSM, men who have sex with men. It's people living with HIV. It's people who have had syphilis and who've had other STIs. You need to be talking with people from these communities. And so for us, it was really it was a good signifier, like, okay, good, we were talking to the people we needed to talk to, but it's also like who people saw as being the most needed to be involved in this research.
Super, thank you. Justin, I wondered if you could tell us what you thought were the most significant findings of the research, and were there results, for example, that particularly surprised you or challenged existing assumptions about participation in syphilis vaccine trials?
Well, first of all, I can say I didn't know what to expect because, again, this is far from my own area of research. But one of the things that surprised me was how the shadow of Tuskegee continues to be such an important factor on vaccine development, vaccine trials, vaccine acceptance in the field. And I think you alluded to it at the beginning, and the trial was begun in the 30s. It was ended in the 70s. So it's been a long time, and yet it's really continued to affect people. And on top of it, we live in an age, of course, where there's a lot of misinformation about vaccines in general. So all of that is sort of conflated. So I can't say I was absolutely surprised, but I wasn't expecting to see that these issues would be so much in the forefront, and they certainly were.
Thank you. And Joseph, I was wondering for you what you found the most compelling findings were that emerged, and maybe particularly around what discourages or encourages people to take part in trials.
Thanks. I would agree with Justin that the long shadow of Tuskegee was surprising to me, that these participants weren't prompted, and several brought up the Tuskegee study. So I guess to me that was quite important. But even amongst the people that had heard of Tuskegee, were concerned about it, there was enthusiasm for participating in a syphilis vaccine trial. So I think the silver lining here is that with community engagement, with really strong community partnerships, I think syphilis vaccine research can move forward. And the importance of strong community engagement was another key finding that I thought was quite important.
Great, thank you.
Yeah, again, one of the other things that came out of the study, in my view, is that there were a lot of people who have taken an altruistic attitude, even though they may have concerns and some misgivings because some things that happened in the past. There were a lot of people who really recognized how important it is to develop a vaccine for their peers, their friends, their loved ones. And I think that came through very strongly. So I think that was an important finding from my perspective.
Yeah, that was somebody reading it as well that really came out in terms of you had both this mistrust, but also, this desire and more altruistic view as well. And yeah, that came out very powerfully in the paper. I guess now pointing a question for you all is thinking about what's next. So what do you see as the next step for researchers and public health professionals when they're thinking about aiming to design ethical, inclusive and community-informed syphilis vaccine trials? And both where you're going next, but also where the kind of broader field needs to go next.
Yeah, that's a really good question, Emma. So, this was like a very exploratory study. We were like, what can we learn as a sort of initial step, right? We learned a lot about what people wanted to see for community engagement. And it was interesting, we highlight this in the paper, but there was two big things I think that we learned for community engagement. One, we need to sort of start more with education. That was something that we repeatedly heard from our participants. Like, there's a need for more information. Like, what is syphilis and what would a syphilis vaccine do and how would it help and why is it important? That was like a big theme in that. But the second thing that we heard with community engagement that I thought was really important was you need to be in the community as a researcher. Like, they wanted to see more like a boots on the ground effort to really be there and show up and be known as a researcher in affected communities. And so for me, just thinking for next steps and for thinking more about how we can engage communities on this, that was a really powerful lesson to learn from this, is that for next steps, we can't be thinking of engagement as something that's sort of done separately or like added on to the research. It has to be kind of in tandem, and it needs to be happening within the community. We have to really be showing up. So the next challenge then for us is like, how do we do that as research progresses? Because research progresses like slowly too, right? Like we don't have a vaccine yet. It was funny too, because like I would be asked like, okay, so when are we going to get this vaccine? When is this coming, Suzanne? Like they would ask me and I'm like, oh, I'm so sorry. I'm not a clinical researcher. I can't make it go any faster. But there was a lot of interest in it. And so for me, the challenge is like, how do we build that engagement as we're going along, as the clinical research progresses? How do we keep people interested and involved over like really lengthy processes? And also, how do we, for ourselves, improve our engagement methods as we go so that we're learning in tandem too with the community? I think that's kind of important for me. But I'm curious to hear what Justin and Joe have to say about next steps too.
Thanks, Suzanne. Practically speaking, this is a really difficult time for NIH-funded research. So there's a lot of uncertainty about what are kind of key priorities, just broadly related to infectious diseases. At the same time, syphilis causes a huge morbidity and mortality. And I think there's been strong support for syphilis research from a lot of different areas. I agree completely with what Suzanne mentioned about underlining the importance of community engagement. And I would maybe even go a step farther and say that like our typical approach to community engagement isn't enough, that we really need to have some like special pathways that are even more engaged or earlier than we would typically if we're talking about syphilis vaccines or related syphilis research. And then I suppose the other kind of like what's next is it's also about talking to communities and thinking about assets, that what are the strengths, what are the things that are going right in the community, even though it's a difficult time for researchers and communities in many parts of the United States. There's also, I think we would be remiss to focus entirely on the negative parts, and we need to tap into some of the headwinds related to community-based participatory research and working in partnership with local communities. So I feel like I'm really excited about the next steps here, and I feel like there's a path forward. But I'm curious also to hear what Professor Radolf has to say.
Yeah, so one of the points I wanted to make, which is very important in my view, is that syphilis is a global problem. Our U19, one of the reasons why it was so successful is because we were able to develop sites in several areas that were globally distributed, which is very important from a basic standpoint. But now that we're thinking about vaccine trials, it's important to take the kinds of issues and approaches that Suzanne developed and apply them to other areas, because even though there's specific reasons why people may or may not be inclined to participate in trials may differ geographically, you're going to be there. That's one thing which I have learned. And so extending our reach is very important in anticipation of the day when we do have a vaccine. We're not there yet, but we are making progress. And I'm happy to say that Suzanne's project, which initially was done, the paper was done in North Carolina, UNC Chapel Hill, but she has extended her reach significantly. And I think I'd like her to discuss that.
Yes, I mean, stay tuned. There's more to come from this project, more exciting work to come. I'll be presenting actually at and I always get this wrong, it's the HIV and STI World Forum in Montreal in July, this coming July, on findings from an extension that we did of this project based in Malawi. So essentially replicating the same study, but in the context of Malawi, where we know, as Dr. Radolf said, that where we know in the future there will be vaccine trials. And we want to know whether and how the barriers and facilitators differed. And spoiler, but there were some variations. There were some interesting findings that were unique to the Malawian context. And so I'm going to be presenting those findings at the conference, and I think we have a lot to learn from there. And I think it's really important that we do that kind of work, replicating this in sites where trials are going to be held. It needs to be relevant to the specific places and spaces and contexts, socially, culturally, politically, historically, in which the trials are being run, right? So stay tuned for more.
Oh, great. That sounds very exciting. Yeah, and I look forward to hearing more about that. So finally, I just wanted to give you all the opportunity if there was anything else that you thought was important to highlight about the context of the work or about the paper, particularly for our listeners.
I guess I'm just really pleased that this is a kind of paper that there was interest enough in to invite us to this podcast for, particularly because it's a qualitative paper that contains the voices, like the actual voices of our participants, with excerpts in their own words about what it meant or would mean to them to participate in a syphilis vaccine trial. To me, it was actually just really exciting to hear that there was interest in that. And all I could think of is just the wonderful, amazing people that I spoke with for this study, how moved they would be that there would be interest in, enough in this paper to make a whole podcast about it and to feature it and to really put it out there. Especially if you look at the paper and you see some of the themes that are in there, particularly around the barriers, where people really felt quite strongly about how important it was for them, to feel like they could trust researchers and that they could be heard and that their concerns could be heard. So I guess I just really wanted to highlight that and just how much I feel like it would really mean to my participants to know that there's interest in learning from them and hearing their voices.
I wanted to say, you used the word interdisciplinary, and I think that is the watchword. It really opened my eyes to the importance of going forward, not just in terms of the basic research, which we still need to do, because there's still a number of questions and issues that have to be overcome to develop a vaccine, which I won't go into, but exactly when we'll have them all solved is not clear. But we have to think broadly. We have to think in terms of how to do the trials, who's going to be involved in the trials, how do we train people? That's turned out to be a very important issue when we begin to get the U19, the Cooperative Research Center, organized, that we had to really very extensively engage clinicians and investigators at the individual sites to make sure the work is being done uniformly, being done correctly, patients are being properly documented, everybody's compliant with all the various important issues that are necessary for doing human subjects research, monitoring it very carefully. And so this kind of research, in my view, fits very much into that and needs to be part of the overall thinking as to how we're going to deal with this problem, syphilis, that has become such an enormous global public health problem. I mean, syphilis rates are exploding, and the cost to humans, particularly babies, in underdeveloped countries, congenital syphilis is rampant. Congenital HIV has largely been conquered, but congenital syphilis has not been. So we have our work cut out for us. And this kind of research in the communities is going to be a very important element in order to come up with a really successful global strategy.
I completely agree with Justin. And I guess the other thing that struck me about this piece of research is that to really do strong behavioral research on syphilis, we almost do have to kind of go back to the past of Tuskegee, of history. I don't think those issues have been completely addressed, and those kinds of lingering historical, cultural issues have sown mistrust, and it's going to be really difficult to reach the people who most need to be reached without addressing those issues. So I think that's one point. The other point is that the team that did this research, led by Dr. Day, was really the A team. Like, Dr. Day is very soft-spoken, and she's a wonderful listener. She's not like a big personality, but like, she was really remarkable, fantastic from the beginning to the end of this. And so I just want to clap for Dr. Day and her team of students that she led, and also for Professor Radolf's leadership, that I think there are very few syphilologists on planet Earth, and none of them are as smart or as, distinguished as Professor Radolf. So we really had the A team.
I don't know what to say to that, but in any event, it was really a tremendous experience. And the next phase is going forward. Come to Montreal, everybody, if you want to hear, because that's where Suzanne is presenting it.
Great, thank you. Yeah, I've really loved talking today. It feels like we could talk for ages about the paper, and it's lovely. Many of the things that kind of struck me in reading it have just become more alive in the way that you talk about it, and that's been absolutely fantastic. So I just want to finish by thanking you all for your contributions, and to say to our listeners, you can read the full article online and open access. The link to the papers in the show notes. SRHM, we're committed to advancing sexual and reproductive health and rights through rigorous research and meaningful dialogue. If you're working on issues related to syphilis, vaccine equity, or community-centred research, we welcome future submissions and collaborations. And we believe more broadly in turning knowledge into action, and that starts with conversations like these. So thank you again for listening, and we hope you'll stay connected with SRHM.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.